What's going on, guys? Spencer here with HR Massage, back with another video. Today we are going over a low back massage that's going to address the Quadratus Lumborum. This little muscle causes so much low back pain and so many problems for people. So let's talk about how to reach it, since it's such a deep muscle, how to massage it and release it. I'm gonna show you guys how deep this muscle is here. We have this nice overlay of muscles. This is the superficial or topmost layer of the muscles. We have the traps, the lats, the shoulders, a few rotator cuff muscles. Underneath this, we go into the second layer. Here you can see that we've dropped down a deeper layer on our left side. So we now can see the rhomboids at the top and levator scapula. There are the couple of rotator cuff muscles we talked about. The serratus inferior posterior, which is the 4 lines of diagonal musculature that you can see in the low back. And then underneath those muscles that run straight up and down, that is your erector spinae group. It's 3 very long muscles that run along the spine, called your spinalis, longissimus, and iliocostalis. Finally, deep to those muscles, underneath the obliques, we have the Quadratus Lumborum. You can see that muscle on the left side where it attaches to the bottom rib and then runs down and attaches to the top of the hip bone, the iliac crest. The Quadratus Lumborum is back pain. There are so many times where I find that QL is responsible for all of the client's low back pain, and you can see just how deep it is. Let's overlay all 3 of those together, and you can see just how much tissue you have to get through in order to even reach the QL. And then you have to know the right angle and how to apply your pressure in order to get it to release. You can't just press straight down on it like you could the erector spinae group. So let's talk about how to hit that angle. Of course, after we warm up, and then I'll teach you guys how to go in from the side, preferably using your elbow. But you can also use your knuckles or your fingertips. But I'm gonna be doing this nice warm-up. I wanna show you guys this technique. You are pushing the erector spinae group away from the spine. And you can actually see me slightly popping off of the ESGs as I push away that muscle. And I'm gonna follow it all the way up until they dip underneath the traps. And then I'll just push the traps away from the spine too. I come in for a nice transitioning move into the neck, keeping in mind that although this is a low back massage, those ESGs run from the low back all the way up to the neck. And then I iron them out with my knuckles. Nice, deep, slow pressure, just running down the length of the spine on either side. So even working upper back is going to work low back. And as an extension, when you release somebody's low back, you have to release their hips as well. I do have a hip massage video I just uploaded, so feel free to go check that out. But I pushed away the ESGs, and then I come to the side and I start pushing away the other side. I'll follow down to the sacrum and the iliac crest and just working that SI joint. You have this whole lower area of tension called your thoracolumbar fascia. So it's important to warm up and just do some releasing on this big fascial chain. I'm also working the lats, because as our overlay shows, the lats run very low into the low back and will pull on all of the musculature. I do some head and neck work there, but this is a low back massage, so we don't get to see any of that. Instead, I'm more just flat palming, softening up all of the ESGs and the lats. We want to really make sure those 2 top layers are open so that we can get into that Quadratus Lumborum. Finally, let's switch angles here, and I'll show you how I really get into the QL. So here we are. I've gotten to my knuckles. I have them stacked next to each other, and I'm applying long sustained pressure to the erector spinae group. I find the origin right along the spine. I press down pretty hard, and then I'm dragging away. And then here's the trick. As I drag away and it softens up, coming from the side, I'm going to press back into the person's midline, and then I start to angle that pressure upward. Look at that. That is going to be very tender on people. Because we've switched the angle and we're getting into the side, we are now going to be accessing those deep muscles, the deep QL, as well as a little bit of the deeper ESG layers. And you can really see the low back start to melt and soften up. So it does look like I'm doing a couple of hip pins, and I know that I go on to work the sacrum and the iliac crest, and also a little bit of the glute medius. But here I'm using a lot of fingertips, actually. I think for this client, the fingertips were the tool of choice. Most of my clients, I'll end up using my elbows. I found a short clip of me doing that elbow hold just to show you what it normally looks like instead of fingertips, or simply as having a different option than fingertips or knuckles, because it's important to always save your hands. So there, I'm just deciding, okay, I think there's tension in the iliac crest and the upper glutes that's pulling on the lower QL. So I decide to go in and release the hips just a little bit. Once the side feels complete to me, all the muscles are relaxed enough that I feel I can move on. I'm gonna move to the other side and do the same exact thing, making sure that the client stays balanced. Thank you so much for watching, guys. I hope you enjoyed the video and it helped you out. Give it a thumbs up if you did enjoy the video, and leave a like. And subscribe to the channel for more content. I will see you guys on the next video. I hope you have a great rest of your day.